Okay, looks like it's 1:15, so we will get started. I believe we're rolling on social media, so everyone can hear us now. Good afternoon. I'm Yael Cassander, Communications Director for the City of Bloomington, and thank you for joining us here today for our weekly press conference with local leaders on the coordinated response to the COVID-19 pandemic. We welcome questions from press as we finish initial presentations from those assembled here. And I will be reading those from the chat if you would just enter them there. But we will get started first with a presentation from Bloomington Mayor John Hamilton.
Thanks so much. And thanks, Yael, for covering this week. Good to be with you all. I'll just very briefly today do the normal update. This past week, we had one employee test positive for COVID. That's good, going down from 6 2 weeks ago and 3 a week ago to 1 this past week. We appreciate that direction. Our utility wastewater detection effort still is at a non-detect or barely detect level. So that's a good indicator. And we're still at 64% of our employees having indicated they have received the vaccine over the last months. I will share one news item about city employment directly, which is we just released our open enrollment period starts for 2022 health benefits, I think on Monday. And we indicated that actually for the first time in 8 years where we've had no increase in healthcare costs passed on to employees, we are seeing a $600 increase in healthcare costs for employees. That does partly reflect in a way the pandemic and its impact on our workforce. That $600 increase for employee healthcare coverage. However, any employee who demonstrates they have received the vaccine will get a $600 rebate, a wellness rebate for 2022, reflecting the fact that it is healthier and less expensive when people are vaccinated. So that will be going into effect in 2022, just letting people know that. I want to note, I'm sure you'll hear, we are going to continue to see positive directions generally on the pandemic numbers, deaths, positivity rates, caseloads, hospitalizations, both locally and in the state and also across the nation, frankly, for most parts of the nation. But I will just share 2 quotes, which I remember and appreciate. One is CDC Director Walensky, who said, "We have to be humble about this virus. When we think we know what's going on, it's always important to remember that exhortation to be humble and stay steady in what we're doing." And I'll quote our own Health Director, Penny Caudill, who said, I'm paraphrasing probably, but something to the effect of, it's going to be as complicated getting out of this pandemic as it was as we were getting into it. And not to think we know everything that needs to be done or has to be done, but to continue to recognize this is complicated and fraught, and we're not out of the woods by any means. So keep masking, keep getting vaccinated, and boosters as appropriate. We know that children that may adjust for making some vaccines available to younger children soon, which would be terrific, and get your flu shot. I know you'll hear that. I want to just close thanking all the very, very hardworking healthcare workers who continue to take care of our friends and neighbors. Too many of whom are sick from this pandemic, and they continue to save lives even as we're seeing progress. And we so deeply appreciate that and send our support and thanks as a community. And I'll hand it back and take questions.
Thank you, Mayor Hamilton. Well, that supplies a perfect segue to the eminently quotable Penny Caudill, Monroe County Health Department Administrator.
Thank you. Good afternoon. Today, I really want to touch on a few questions or comments that we've seen recently or have come our way, just to maybe provide a little more clarification. So the first one is, how do I know when our county status, what our county status is, or when the current health regulation will end? So the current health order is set to expire in one of the following ways. Either we reach less than 50 cases per 100,000 and we are in a blue advisory level, and that information can be found by visiting coronavirus.in.gov and looking at that map. You'll see options in a drop-down box. You can click on the advisory level, and that tells you what the official advisory level is by color. Currently, Monroe County is in yellow, and that is a 2-metric score using positivity rate and a case rate. You can also select per 100,000, and you can see what our case rate is per 100,000. Currently, it is at 114, which is high community spread, and we're at an orange level there. You may also look at the positivity rate, and currently we are less than 5%. So if we reach this goal, then the regulation would automatically expire at this time. The other way that it could expire is by date. There is a date of October 31st at midnight. And so if no further action was taken, it could expire on the 31st. And the third way that you'll know that when it expires is that it could be extended. If the Board of Health and Board of Commissioners decided to extend that order or to make changes to it, then that would change the date. So an example for that would be that the Board of Health meets next Thursday at 5 p.m. If that goal regarding cases and the advisory level has not been met, then the board may want to extend that order until we reach that level. They may look at the data next week and say, we're close enough. We think we may be there by the 31st. We're going to let it ride, and then we're going to watch it. So there are a multitude of things that could occur to change that. But right now, those are the 3 things to be looking for in terms of when that order might change. The second thing that I'm hearing is, don't vaccines always prevent illness? Or if I'm vaccinated and I had a breakthrough case, then the vaccine wasn't working. And that's not accurate. Vaccines teach your body's immune system to recognize and then defend against harmful germs. And those could be viral, for instance, COVID-19. They could be bacterial, like tetanus. Once you are fully vaccinated, so you've gotten the 1 or multiple doses that you need for that particular vaccine, then protection works by doing one of several things. It helps your body fight off that infection, in which case maybe you won't get infected with whatever it is you were vaccinated against. Or you may actually get infection, but your body will fight it off enough that your illness will be milder, and that you may not end up in the hospital, you may not have a severe case, or have a death occur because of that. So all of those things to say that this is why breakthrough cases occur. We expect breakthrough cases from vaccines because they will not protect 100% of the population from ever getting the infection. But that doesn't mean that the vaccine is not working. It's still working if it reduces your severity of your illness, if it keeps you out of the hospital, if it keeps you from dying. Currently, Monroe County is just over 60% of our eligible population is fully vaccinated. Now, I was thinking about that, and that rate could be slightly higher than that as a community because Indiana University has an extremely high vaccination rate. And many of those students are freshmen that are coming into our community. So it could be a little bit higher than 60%, but either way, the higher the vaccination rate, the better off we are as a community. Breakthrough cases that I just talked about only account for about 1% of our fully vaccinated population. So we know that most of the infections that are occurring are in our unvaccinated population. You can find that information about vaccinations on the vaccination map with zip code areas, even on that state dashboard as well. And you can see that our major zip codes have all topped the 55% fully vaccinated. So those are steps in the right direction that we're making. A third thing that I've been hearing is what's up with boosters and vaccines for children 5 to 11. Everybody's talking about that. Those reports are being reviewed, and they are moving through the recommendation process. We've talked about that in previous meetings. Various committees look at this, make recommendations before final approvals and directions, whether it's emergency use or actual approvals. It will likely be early November before we have more full direction and approvals for what comes next. But know that we are planning both at the state and the local level for how we will bring those vaccines to those individual groups, and we will account for demand. So whether we need to expand, look at different locations, we have been doing school clinics with our students, younger population, sure that we will still be doing school clinics, making that an offer, and pediatricians' offices will be doing those children 5 to 11, but we are looking at other options as well. Currently, we continue to give those first and second doses of vaccine, but I will tell you that the demand is greatest among those people who are getting that Pfizer booster. So we're glad that you're getting the booster if you're eligible for it, but the demand for vaccine right now is being driven by that group. And we would like to see it driven by those who haven't even gotten their first shot yet. And then I'm hearing a lot of questions about Halloween and the holidays, and I'm going to try to share my screen. I want to share something really quickly, if I may. Can you see that? Because I can't tell if you can see that. Can somebody tell me, yes, you can see that? All right, wonderful. If you want a more normal holiday with your family and friends, make sure that you are fully vaccinated. It does take about 2 weeks to build up the protection that you need, so vaccinate now. Make plans with safety in mind. It doesn't matter if we're talking Halloween, Christmas, Hanukkah, Thanksgiving, whatever it may be. Make your plans with safety in mind. If everyone is vaccinated, then you can take recommended precautions and your risks should be very low. Do watch community transmission and adjust your plans accordingly. The higher the transmission level in the community, the more precautions you want to have in place. With trick or treating, this is mainly an outside activity. Your community officials will set whether or not there's community trick or treating hours. But if you are looking for things that you can do with your family, just know that outside activities are what you want to do. Avoid crowds, being indoors with people who are unmasked, unvaccinated. You know, last year in our neighborhood, we did Halloween, we did it outside. It was great. We took lots of precautions, and it was one of the best nights, one of the best trick-or-treating nights in my neighborhood that I've experienced. So it can be done safely, and it can still be very enjoyable. And then the last thing that I would mention is that flu season is here. Vaccine is available. Now is the time to be vaccinated before viral activity increases. Right now it's at a lower level. Remember, it may take some time to develop that protection that you need. And flu and COVID-19 vaccines may be co-administered. I've already had my flu shot, and I ask that you join me in vaccinating and protecting yourself, your family, and your community.
Thanks so much, Administrator Caudill. And Amanda Roach from IU very kindly placed a link in our chat here that we can also carry over to the Facebook Live audience about how boosters work and how vaccines work. So thanks a lot, Amanda. Let's go next to Monroe County Board of Commissioners President Julie Thomas.
Thank you, and thanks everyone for being here. And I just want to start off by reminding everyone that we have some blood drives scheduled. The next for October, we have October 21st, 2 p.m. to 7 p.m. and October 22nd, 10 a.m. to 3 p.m. Both of those are at the Southeast YMCA. And in November 3rd and 5th, we have 2 more blood drives scheduled at the Northeast YMCA, 10 a.m. to 3 on November 3rd and 2 p.m. to 7 p.m. on November 5th. If you are able to, please contribute. And all you have to do is go to redcross.org and look for Monroe County information. Another good way to stay on top of things when health orders are issued, extended, changed, or let's hope rescinded because we're all healthy, is through our emergency alert system. Any Monroe County resident is welcome to sign up. It's free. And this is provided a lot of great information for folks, not only about weather warnings, road closures, road warnings, but also, of course, our health orders are always posted there. If there happens to be a pop-up clinic of any kind, that gets posted as well. So just go to co.monroe.in.us and click on the megaphone on the main homepage screen. And just today, I saw a news story where they surveyed American households about the financial impact of COVID-19 on their finances. And according to this survey, 40% of American households say they face financial difficulties. Families are having a difficult time paying for things like rent and utilities. Well, we have a program for that for our Monroe County residents. We worked with Board of Commissioners, worked with the County Council to come up with the Township Assistance Fund. Now, this fund can only be available as long as there's a governor's order. So for now, we only know that this fund will be available through the end of October. If you're struggling to pay your bills, contact your township trustee. Every resident of Monroe County has a township trustee, whether you live in the city, town, or neither. And you can go to you can call 211 or go to in211.org to find information about your trustee. And again, thank you to everybody who's been vaccinated. Really appreciate you. And thank you to everybody who continues to mask up to protect those who cannot be vaccinated. And a huge thank you to everyone in our community, essential workers, our healthcare workers. We really can give them a break by getting vaccinated. So thank you, and we'll take questions.
Thanks, Commissioner Thomas. We go next to Brian Shockney, who is the IU Health Central Region President.
Good afternoon, everyone. Thanks for joining us. Our region continues to experience a steady volume of COVID-19 patients, and unlike the previous surges, the decline in the prevalence of COVID-19 in our community and patients in our hospitals is slowly declining rather than a fast decline. But that's okay. The numbers are declining, and it's the same as we see in Monroe County. And as you can also see in the majority of our patients in our graphic that we've been sharing each week, continue to be unvaccinated individuals. And as of this morning, we do not have any vaccinated COVID-19 patients in our critical care or on a ventilator. Just as our health administrator, Penny Caudill, was saying, the vaccines are effective. While we were hoping to see a more rapid decline over the past few weeks, we are grateful to see any decline at all. We look forward to the downtrend as we continue to approach the holidays that we all love. Speaking of holidays, we don't want a scary holiday, as Penny Caudill said. What plans are you making to ensure safe holidays as we gather with friends, family, neighbors, and coworkers? You know, the best way to prepare is to get vaccinated, not only for COVID-19, but now it's time for your seasonal flu shot. This in addition to ensuring we wear masks, practice excellent hand hygiene, and keep our physical distance when we're in close spaces with those not in our immediate family. You know, reducing the number of people becoming sick from the flu will help reduce the hospital admission rate. So we're seeing admissions with COVID, but we're also seeing admissions with flu as we do each season. And this is important as we know our healthcare systems continue to be strained across the country. People are having to postpone their surgeries, and we still are at a point where we cannot catch those up. While it is still early in the flu season, over the past few weeks, we continue to see a slight increase in inpatient cases, and that's the seasonal flu, at IU Health Bloomington. In 2020, we were able to experience a pretty low flu case and admissions because we were doing all the things that are necessary. In addition, we were kind of hunkered down and isolated in our locations. Well, that's not the case right now. We're out and about. And so we are seeing some inpatient flu cases right now over the past few weeks that are similar to our 2019 numbers prior to the pandemic. And so that's causing us a little concern. So we would just ask that please continue or consider for the first time to help reduce the flu's impact in our community by getting your flu vaccine now, rather than after the spread starts and you say, oh, I better go get my flu shot. Do it now. Do it as preventive medicine. According to the CDC, 913 Hoosiers lost their lives in the seasonal flu alone in that 2019 season that we're starting to mimic. So let's ensure we reduce this number this season. I'm proud to have rolled up my sleeve this week to get my flu vaccine, as Penny Caudill did, and got my COVID-19 booster as well. I hope you will join me in keeping our community safe by doing the same. I am happy to take questions at the end.
Thank you, Brian. Let's go next to IU Vice President for External Relations and co-lead of the IU Bloomington COVID-19 Response Unit, Kirk White.
Thanks, Yael, and good afternoon, everybody. Our IU numbers, as I normally go through our vaccination rates this past week, ticked up one more 1/10 of a point. So we're now at 93.2% for students, faculty, and staff. Students are at 93.2, and our faculty and staff are at 92.9. They need to catch up a couple of 1/10 of points. That rate with faculty staff does vary a little bit because where our student population is pretty solid for the semester, our faculty and staff numbers do go up and down. So that's why that decreased 1/10 of a percent from last week. Now, in cases of flu, we went up a little this week. Last week, you remember, we had 21 total cases on the campus. This week, we went to 25. That's still just a small uptick. 20 of those were students and 5 were faculty and staff. Again, last week we had 15 students. This week was 20. And last week we had 6 staff members. This week, 5 with COVID. That's still low for the semester. Just reminding you, way back on the 3rd of September, we were at 91 cases for the week. So down quite a bit. So we think we're continuing to make good progress. And another good indication of that is of the 104 students that presented at the IU Student Health Center that were suspected that they might have COVID. 104 of those students got COVID tests, but there was 0 positivity among all those students. So again, as we've discussed, it's still a season where we are starting to see the normal head colds, allergies continue, and things like that. And as we move to thinking about the flu, I'm happy that almost 2,500 of our students, faculty, and staff showed up on the 12th of October to get their flu shots at Assembly Hall. So that was a very successful mass flu clinic. Our next one will be the 24th of October from 12 to 6. We do ask folks to make a reservation for that. It's not a requirement, but we do encourage that because it helps us really kind of track the flow so we don't have too many people standing in line. And I'll go ahead and put the link on there for making an appointment and getting your flu vaccine on the 24th of October. So good progress there. I went through our clinic on Tuesday, and my daughter did as well. We were in and out of the building in 10 minutes. It's easy parking, well done. And so I encourage you, if you haven't had a chance, take that Sunday opportunity on the 24th from 12 to 6 to get that done. Then finally, I just mentioned this weekend is homecoming, and the parade's today at 6 o'clock. Hope the weather holds for us, and we'll have a successful parade, welcoming lots of visitors back this weekend. And of course, we want to remind everybody to stay safe in all those activities that you have either pregame or at the game tomorrow. With that, be ready to stand by for questions. Thank you.
Thank you, Kirk. All right, so we do have our first question from the B Square Beacon, and this one's for Brian Shockney. You talked, Brian, about the fact that hospitalization numbers in our area are declining, but only slowly. Based on the state dashboard, it looks like hospitalization numbers for our area are not declining as fast as they are statewide. That's even though our area's positive case numbers are showing a similar downward trend as statewide. Is that a fair characterization of the data? And if so, is there anything that helps explain why we're seeing this pattern?
Yeah, so there's a couple things at play here. One, those who are admitted to our hospital are regional, from 11 different counties that we get patients from. Also, the counties around us are not declining. I believe just this week, Orange County either stayed the same or increased in their positivity rate. So we are affected, our hospitalizations are affected by the area that we serve. Another factor is our patients who have COVID with this Delta variant are sicker and their lengths of stay are longer than what we saw previously. So where we would have patients previously in previous surges who would discharge quicker or would have less lengths of stay, we're seeing a longer length of stay with many of our patients in this surge. So that's keeping patients in the hospital. And then we're also seeing a higher number of patients who are coming to us, even though we see lower rates because of this Delta variant being so aggressive to our patients, specifically those who are immunocompromised or have other comorbidities. And so it really does affect the human body in a way much more severely than the previous variant, the original alpha. So those are there's a lot of factors that are affecting that. Again, I'll just say vaccination, vaccination, vaccination. That solves all of this. So thank you for the question, and just continue to get your friends, relatives, and anyone else out there getting vaccinated.
Thanks so much. This is our weekly press conference on all things COVID-19 in Bloomington and Monroe County, and we're here with local leaders managing the local response. Here is a question from Patrick McGurr of, let's see, I believe either WFIU or the HT, you can clarify, for Penny or Brian. Has Delta outcompeted other variants for the time being?
Well, certainly Delta is the variant of concern, and what we are seeing almost 100%, if not 100%. So certainly it is the dominant thing that we are worried about.
Anything to add, Brian?
I don't, thank you.
All right. Well, we have more time for questions if we have any from the press who are assembled here. Any questions on testing, vaccination, or Halloween protocols, of course. Halloween hours officially in our area, 5:30 to 8:30 on the 31st. Make it a safe, not scary Halloween. And unless any members of the press have anything additional to ask, or any of the panelists would like to share something else, we can call this a wrap.
Yeah, I'll just mention that link I put in there for the flu clinics also includes all of our other campuses around the state. So if if any of our listeners today happen to be closer to another one of the IU campuses, there are flu clinics at all those, and they're welcome to pick the one that's closest and most convenient for them.
Terrific. That's very helpful. And I'll make sure that we put that on our Facebook page as well. All right. So seeing Aha. Fox 59 is asking, would it be possible to get a copy of the safe/scary Halloween graphic shown earlier by Administrator Caudill?
Sure. We borrowed that, so I will put the link in to where you can get that.
Terrific.
Borrowing is always good, especially in a pandemic.
All right. So unless we have any more questions, that is it for this week's press conference, and we'll be meeting again next week at 1:15 with the leaders assembled here. And Chuck Carney will be back to moderate the session.
Thanks a lot. Have a good
Thanks so
week.
much, everyone, and have
Thank
a
you,
great
Yael.
weekend.
Thank you for your leadership.
Oh,